Homeostasis is the ability to maintain internal stability in an organism. This is done by using a feedback control system to achieve equilibrium. Blood pressure regulation is determined by how much blood is pumped through your heart and around your body, and the amount of pressure of blood flow through the blood vessels. The purpose of blood pressure regulation is to ensure oxygen and other substances carried in the blood are transported to all organs and tissues in the body so they can carry out life processes such as cellular respiration and ultimately sustain life. The receptor detects change in the internal environment when blood pressure levels exceed normal limits in order for the first steps of homeostasis to occur. In African bush elephants, the receptor is called the baroreceptor, which is located in the arterial walls of the blood vessels. The baroreceptor is a pressure-sensitive sensory receptor that sends chemical impulses to the cardiovascular center, which helps regulate the blood. Secondly, the control center, which receives information of the changed environment from the receptor and initiates change again to maintain homeostasis. In the African bush elephant, the control center is called the cardiovascular center, which is located in the medulla oblongata of the brain. This cardiovascular center controls neural, hormonal, and local negative feedback systems to regulate the blood. Lastly, the effector involved in homeostasis for African bush elephants are neurotransmitters called catecholamines. These effectors are released as a result of the control center receiving chemical information from receptors in relation to blood pressure imbalance. The catecholamine transmitters specifically maintains homeostasis when blood pressure becomes abnormally low, as it gets released from the cardiovascular control center and sent to the heart, where it causes the heart to pump more forcefully, as well as causing baroreceptors in arterial walls to tighten and increasing the overall blood pressure. When the blood pressure of the African bush elephant increases to where it's abnormally high, different transmitters called vasomotors bombard the medulla in the brain with nerve impulses. In return, this causes a smaller number of impulses to be transmitted through the nervous system to the heart and blood vessels. Lack of these impulses slows the rate at which the heart pumps blood and dilates the blood vessels, releasing pressure on the artery walls and ultimately slowing blood pressure. Altogether, the receptor, control center, and effector make up the feedback loop. Most commonly, this is called a negative feedback loop because it reoccurs due to the internal imbalance being severe enough to cause disruption to the system. For example, in African bush elephants, severe infection is more common compared to other mammals due to their wild environment and constant exposure to potentially harmful bacteria. If a small cut or gash in the skin of an elephant was to become severely infected, this would have a major impact on the blood pressure regulation in the elephant. With the pressure of an internal infection, antibody proteins are produced to fight the infection. However, these proteins also promote the hardening of arteries by increasing the receptor impulses to the control center. This therefore narrows the artery walls due to a negative feedback loop, causing more blood to flow through a small area and increasing the rate at which the heart pumps blood around the body. This would cause disruption to a homeostatic system of blood pressure regulation, as the system would constantly be trying to maintain balance. However, the increase in blood pressure due to the infection cannot be reduced without affecting the arteries. The extent of which the blood pressure would increase in order to fight the infection would eventually cause death to the elephant and therefore disrupting the system. Due to the large size of African bush elephants, adaptive advantages are useful to help ensure the survival of the species. A key adaptation is the four-chambered heart, this weighing around 12 to 21 kilograms. This immensely strong muscle is needed to successfully regulate the blood pressure of elephants in order to transport enough oxygen to all the organs and tissues so that life processes are carried out at a rate that sustains life. This has major significance to the homeostatic blood pressure regulation, as with a weaker, smaller heart, would most likely not tolerate the feedback loop, which would increase the blood pressure at a rate that's not within the capabilities of an African bush elephant. thus potentially resulting in heart attack or death. Another key adaptation that specifically affects large mammals such as the African bush elephant is the ability to transport oxygen using the protein hemoglobin. Because oxygen is only 1.5% soluble, hemoglobin is necessary to transport oxygen efficiently in the bloodstream. Hemoglobin binds into four oxygen molecules to maintain a balanced blood pressure. Without this adaptation, the receptor, control center, and effector would be in a stressed environment to increase the blood pressure and successfully transport enough oxygen around the body at a rate that sustains life.